Welcome to another episode of What Brings You In Today.
I'm Erica Bennett.
And I'm Taylor Fisher.
And we just want to thank our listening audience for tuning in to SGMC Health's podcast and learning about our health system and what's going on in the atmosphere around healthcare.
Yes, and if you have any questions you would like to submit or any topics you'd like to hear our experts talk about, you can submit those at sgmc.org/podcast.
All right, and we're really excited today because we have our President and Chief Executive Officer, Mr. Ronnie Dean, in the studio. So, Mr. Dean, what brings you in today?
Well, good morning, Erica. What brings me in today is I get to talk about our great people at SGMC Health.
Mm-hmm. And it's been over a year since we last had you in our studio. Mm-hmm. We've done a few updates, so we're in a new little space, but a lot has transpired at SGMC Health over the past year. So tell us a little bit about it.
Well, it's sort of a continuation of a journey that began some years ago. We exist for one reason only, is take care of other people, and everything we do is with that intent in mind. So what's going on today is about, that objective, that mission. We're rapidly developing a healthcare delivery system, and we're continuously expanding, and we've really just begun. And what's going on today is that we're onboarding more physicians, we're launching more specialty care programs, we're expanding our primary care, we're adding new facilities and new technologies to support our physicians and these programs that they bring due to their expert training. And we're serving more than we ever have. Our capacity is being challenged at all locations because people are choosing to come here not only from the primary service area, but from a wider region, and that's the objective. We want to be available to South Georgians and neighboring communities so they don't have to travel for care, and that's what we're up to today.
Yeah. You've been here now for 5 years as the president of SGMC Health. And I will say from my perspective, from our team's perspective, because our job is to really share all the information all the things that are going on. I feel like a lot of things were put in place initially that you can't really see. A lot of behind the scenes things, a lot of operational things being put into play, and now I feel like we're really starting to see the fruits of that labor, whereas things are really rolling. Things are starting to happen. And
yeah, it is. It is kind of hidden in a lot of ways, but I think what you're really talking about is our people in action. We have our frontline clinical folks that take care of people directly, and then you have all the rest of us that are behind the scenes that are taking care of people indirectly. There are two types of folks that work in a healthcare delivery system. It's one, those that care for folks, and then there are those of us that care for those who care for people. And so all that's sort of coming together, but it's centered on developing a culture of high reliability and excellence in all we do. Every job has an important aspect in the delivery of that care, achieving that expected outcome, that desired experience. And then each one of us, we're expecting as employees of the health system to have an experience as a member of this team. So everything we do is about our team and enabling them to be great for each other and transfer that to the bedside. When someone comes in for a procedure or an overnight stay or to have deliver a baby or whatever we want to, we're working hard behind the scenes. So it's really culture. You think about where we started, and now where we are. Well, we're just beginning, and we're not 100% yet. We're asking ourselves to do more, think differently, live our values, be accountable to one another, be accountable to those that entrust their care to us, such that we are reliable. High reliability, when we arrive at being highly reliable, that means that we're not sometimes, we're always. So getting it right always, that experience and how people feel about us always. very challenging in the environment that health systems work within because it's constantly changing and there are pressures on the team. So focusing on the team, what they need, it's not just the number of team members, but what is it that leadership provides every day? Is leadership tuned in to the team's goals, dreams, and aspirations? Work is a part of life. It's not our life. So all of that stuff is working behind the scenes to achieve this destination these destination services, and it enables our physicians and the clinical teams to just be remarkable. And that's why I think things are moving so rapidly for us.
Mm-hmm. It's been exciting. I think I'm almost a year and a half of being here, so I think I got a front row seat of a lot of exciting things that have happened in the last year. I feel like I came on board right as we relaunched as our new name, and then we've had all of these exciting things with the Mercer press conference we had to announce that partnership, and we've just seen so much growth in the last year, which is it's exciting as a newer employee to an organization.
Well, and it's exciting to me to be in the role I'm in, but it takes all of us, and you in this podcast and all you do in your other jobs enable what I'm talking about. If you think about it, 3,200 families depend on this place for work. They could choose to work elsewhere, but they choose here. Why? Well, maybe it's the pay, maybe it's the benefits, but I want to think it's just a great place to be. They have friends here. They believe in SGMC Health. And more importantly, they like being a part of an organization that wins for the right reason. It's not about themselves, it's about others. And so pulling all that together so we're feeling rewarded in all we do is a part of this journey that we're on, and it is often unseen, and you talked about that. We can see the buildings go up. We hear about the Mercer University School of Medicine affiliation. We hear about the new program that's being developed. A new robot is purchased, another technology. But what you can't see is how we're interacting with one another, and that's what I'm most proud of. I feel blessed to be able to work among such bright, capable, and willing individuals that want to do this with me. And I'm talking about everyone. It doesn't matter where you are in the health system, everybody's chipping in. We talk about in our connection sessions that, there's no bigger job than the job one is in. Everybody's job is important to where we're going. And why is that important? It's because someone's life depends on it. I mean, we exist to take care of people, and they come here because they trust us. So that's the exciting part of what's going on, I think, at SGMC Health. You mentioned Mercer University School of Medicine, our teaching mission. We're here to take care of people, but now we're a teaching hospital. Very exciting news. We not only are having a graduation of our first class of internal medicine residents. They're going to graduate. They're going to be board eligible to be board certified internists. That's coming up here in the next few weeks. But we're now onboarding our next class of internal medicine residents through our graduate medical education program. Just a few days ago, we maxed 100% of our internal medicine slots. And then we're starting a new transitional year residency where 10 physicians and their families will move here for at least a year, and they've enrolled and have maxed to a new transitional year residency that we host here as a part of our graduate medical education. And so we've expanded. So think about that. That's 10 new internal medicine residents and 10 new transitional year residents, plus the second and third year residents. And then in just a few more weeks, we'll onboard our next class of Mercer University School of Medicine medical students, and we'll have a third and a fourth year class of medical students. And that's all working inside of what we just talked about. Now, why is that important? Well, we have to be mindful of the workforce needs of the region. We can't just sit idly by and expect that supply of physicians to just happen for us. So we made a strategic decision to partner with Mercer University School of Medicine for the purpose of stimulating a pipeline, a bigger pipeline of physicians for South Georgia, and it's working. There are several of the residents that are graduating in this class. They come from many different areas, but a number of them will remain here and work in South Georgia.
And what is the statistic that the number of ones who stay where they trained? Isn't there a statistic about that?
It is. There's a high percentage that'll stay within 75 miles of where they complete their residency.
Yes. And why is that important economically?
Well, that's a great question. So we talk about taking care of the needs of the community so they don't have to travel, right? If you can't access a physician, you may have to travel. But every physician that remains here also generates an economic halo for the community. I mean, think about it. They buy a house. They have to have a vehicle, food, groceries. Their children grow up here. They pay taxes. I mean, the health systems growing and developing generate big economic halos. It's not the primary reason for it to exist or for us to develop a residency, but it is it's a benefit. It's tangible benefit to the community.
What I see is just a pipeline of young, bright minds and talent that we're just pouring into the system. So aside from access to care, what have you, you're going to have just fresh ideas, energetic workforce that feel like they can help shape the next generation of care.
Again, you're touching on another benefit. Think about being responsible as a teacher. All the teachers out there that teach, whatever grade, whatever level, at the university level, the faculty, you have a responsibility if you're a teacher. You have to know what you're teaching. You have to be good at it. So these residents are entrusting their education to us. They're expecting that we know what we're doing and that we're teaching them effectively. And so when you become a teacher, you become a little sharper and you become a little better. So think about it, it's sort of just like sharpening the tip. It's getting a little fine. So being a teaching hospital makes us sharper, makes us maybe a little more informed, maybe a little more advanced, because you're responsible for educating the physicians of the future. And you're right. When these bright minds in medicine get together and they plan together, they do scientific research together, and they present their papers, their studies, their posters. It's fascinating what we learn as a health system that transfers to the bedside. Recently, we had two posters or scientific posters that were presented, in the state, and we were awarded top awards.
And
here.
Just for the listening audience, posters, because I think of a literal poster, but for those that may not understand what that is, it's basically like a scientific study, a program that they undergo to try to enhance some level of care within the health system. But yeah, we had two of those that were recognized statewide that directly has an impact on the patient care that is received here. And
so what they learned through this study, we've applied it at the bedside. And so that's what comes with being academic, being a teaching organization, in addition to the primary objective, and that is create a bigger supply, bigger pipeline of physicians for South Georgia. It is an exciting part of what we do in that, we are, really developing the future workforce, physician workforce for us as we get older. Everyone ages out. No one's immune from that. And And I know it's hard to, who's going to fill our shoes? Y'all ever heard that song? Well, who's going to follow behind these great physicians that are here? And I mean, we can call them out, but they're going to finish. And who's going to start behind them? So that's exciting, Erica. And I think of all the things we're doing, folks should pay attention to that because it's only going to get bigger. There's going to be more medical students, more residency training. And remember, they come from all parts, not only of the nation, but the world. This is an international group of physicians. They can be anywhere else, and they come here. Why do they come here? Because we make them feel welcome. They believe they're going to get a great education here. And then they remain here because of the experience. And that's what we want.
We've gotten to talk to a lot of them over, the year of introducing them to the community. And so many of them do say that they came here and visited and they love the atmosphere, they love the community, and they felt welcomed. And so they really are loving having their family because a lot of them do already have families and they love it here and they think that they would like to stay after their residency.
And I think that goes back to culture, too. I actually was in an interview yesterday with a potential candidate for a position, and he just could not – he just went on and on about the culture was palpable. He could already see it just in walking the halls and with who he spoke to, that everyone is that excitement because you feel like you're working, even regardless if you're, most people feel like nursing clinical teams, you feel like, okay, yes, they're the hands-on, they're saving lives. They get that gratification. Satisfaction. Okay.
You just put those two words.
Yes. But from a non-clinical aspect, I think it's amazing to be able to work for an organization where you too, no matter what role you play, you kind of mentioned this earlier, no matter what role you play in the health system, you know that you're making a bigger difference and as our mission is to improve the lives of all we serve, and you're able to do that.
And I want to give you an example of that. It just happened this week. Food. I just want to pause for a minute. The listening audience, just ask the question, if we did not have food inside of this health system, what would it be like being unable to feed someone? Nutrition is a part of the healing process, right? So we really just skip over it. There's a meal coming. Well, think about all of the professionals that assemble. They start early in the morning, they work late at night to do what? Not just assemble meals, but assemble tasty meals, nutritional meals, according to what everyone needs. And then they feed everybody else. They feed the public. They feed our employees, our volunteers, our physicians. They rally around this idea that they're going to fuel this team and fuel our patients back to health. And just this past week, they rolled out a new menu around this. It not only meets the bare necessity of having a meal, but it's being displayed in such a pleasing way that you think it's sort of a meal you would get sort of in a restaurant. And so they're putting energy into that because they know it matters to the patient, the family, and even to the workforce. So what value can you put on that job in what we're trying to do? I would say the highest value, because I can't imagine not being able to access a meal in a timely fashion. Physicians in between surgeries, they get to pop into an area where they can have a meal and go back. They're in a trauma and they're caught up for hours and they can't eat, but they know there's a meal or a place to get a meal. Our team, our nurses that work, and we put these food stations throughout the health system and all of our campuses virtually to be able to access food. And this team just rallies around this idea. They exist to fuel, not just feed, but fuel this workforce. And that excites me. And when I interact with them, they're smiling and they're pleasant. And when they make my beautiful little wrap down in the spice, and I just love it, and I can tell you all about it if you want to hear more. It's just, they do it with a smile because they believe in their purpose. Well, that's what we're trying to accomplish throughout the health system. We exist for something bigger than the job. We exist for a purpose in another's life. And if we'll be that always, we'll be remarkable for someone, and that's what I'm excited about.
And I think it's about like reimagining what we can do in certain areas. So I went to the taste testing that they held, and it was phenomenal. There were just dish after dish after dish, and it looked like you were eating at a 5-star restaurant. And I was like, wow, I never really even thought that this could be possible for a patient to eat like this as a patient. And so just to see them take that to the next level because they want to, because they care. And then how can we do that in other areas? And it's exciting because you don't have to be the status quo. You can choose to be, hey, I want to be remarkable or great at what I do, whatever that is. And we're seeing our teams just naturally like gravitate towards that, and it's just really cool to be a part of.
And then if you're going to get it right always, it sort of, it hurts you when you don't. I mean, you feel bad. Oh God, we missed on that. So you think about this idea that high reliability is consistently always. And so being preoccupied with failure is part of the culture, not in a negative way, but in other words, we need to do what's required. So, just this, I guess within 2 weeks, we've launched a new tiered huddle around being always. It's our new tiered huddle system. It's where our teams huddle at different times, at different levels throughout the day. And when they huddle, what are they talking about? They're talking about how to get it right, always. So our communication systems are evolving inside of the culture, and that's about us knowing what the other needs or what's in the way of us being always in whatever we're responsible for. To achieve the number one objective is to be safe, to do no harm, to always make sure we're safe, safety first, and then get everything else right that goes into the care of the patient. So that's more of that behind the scenes that the listening and viewing audience probably would not know that's going on. Meeting with intentionality, not meeting to meet. Mm-hmm. Who's been to a meeting where you sat there for an hour and you thought, my gosh, we could, not, and you do
this
it.
Could have been
you
an
do
email.
It because it's on a calendar. Well, remember, one of our strategic priorities is unmatched efficiency. Mm-hmm. So being efficient with what? Well, efficient with supplies, efficient with, steps. But what about conversations? Mm-hmm. Conversations need to be meaningful. Mm-hmm. Now, we don't need to be robotic where we can't talk about each other's family and have a fun time and reflect on what's coming up. That's not what we're talking about. We're talking about meeting with the intent to impact this high reliability journey. So all that stuff is happening behind the scenes.
Well, and I would say it's working very well as we've just seen our serious safety rate go down. So in that aspect, patient safety obviously is our number one priority.
Number one.
And so many things taking place. You talked about the huddles, which basically gives a voice to the frontline staff to be part of the solution when they identify something that's not happening the way it should. Safety
is our number one. And in that, our patients' safety, our employees' safety. Anyone who encounters the hospitals anywhere, any campus, any service, any clinic, anywhere, should feel safe. If you work here, you feel safe. So that's what these huddles first talk about, safety first. And if we're serious about it, we listen to those voices that are moving that information forward and we act on it. And there's a lot of change that's happened in the system over the last few years. Are we there? Again, no. It's a journey. But we're taking steps, giant steps forward, practically every day, every month, every year, to make sure we're achieving. And some of the results, and you mentioned one, is very good. It's very favorable. And I'd say the team, I couldn't be more proud of how they've responded to this challenge. Winners like to be around winners. Winning teams are contagious. They attract winners. And this team's winning, and we've got a winning group of people that work here. I'm very proud of them.
Mm-hmm. Me too.
Yeah. I mean, I've been so impressed in the last year and a half I've worked here with how many, amazing, compassionate people work here, people who truly, truly care about their patients and their friends, their employees, their coworkers. It really is an environment of care, and not just for patients, but for each other.
And it's hard work.
Yeah.
Don't get me wrong. And it's a long mile when you have to park out in the hinterlands and walk in the rain. I mean, I get it. It's not they work hard.
Yeah.
They're challenged. They may not have as much of a resource as they need at any given time and more to do than they feel. But their intent is to be remarkable. There's good, and then there's great, and then there's remarkable. And every one of us have had a remarkable experience, and it's different than anything else we've experienced. But that's what we're trying to achieve, and I think the team, regardless of the challenges, is responding to this. And at the end, why? Well, it's extremely rewarding to know that what I contributed had an impact on the life of another, a positive impact. And that's what we're buying into. That's our purpose. That's the reason we exist.
I think that's as good a place as any
I know.
to end it. I don't think we could do any better than that.
Is there anything that you wanted to share that we didn't hit on?
Well, I thought you were going to ask me about my favorite meal.
We already
Has it
had
changed
that.
since last year?
I know. No, it may have.
Because I thought
I'm
about
not
that,
sure.
and then I was like, well, and he's already mentioned that chicken wrap. So
That chicken wrap was good, but I did have fried chicken yesterday. Oh, gosh. And I know I'm not supposed to. My physician, he's tuning in. He'll get on me.
well, I might have one zinger for you then.
Okay. Let's hear it.
What is it that you're most proud of that you've seen happen or occur since you've been here in our community?
Here at SGMC Health, what am I most proud of? I'm most proud of our team feeling like they're winning. And if not every day, most days.
Yeah.
There was a time when they didn't feel that way. I wasn't here. And there was a time we weren't winning.
I was here.
And
I was not.
And everything I do every day, I reflect on how difficult that must have been for the community. That must have been for the employees, the physicians, board, management. And what I'm proud of is that we're very proud that we're the pride is back. And that makes me proud. And it's not from an arrogance standpoint. It's from it's just a good feeling when you know that people care about you and believe in you and trust you and thanking you for what you do. And that's happening more and more. Community has been remarkable. It hadn't taken a lot to get our community back, meaning we just got back to what we were supposed to do all along. But the community speaking highly of our team, that makes me proud for the team.
Yeah.
So
Definitely.
that wasn't much of a zinger, by the way.
Okay, good.
You got to come up with something better than that.
Okay. I'll try better next time then.
Well, thank you so much, Mr. Dean, for being with us today and sharing that update and, everything that's been going on. It's really good to hear from you.
Well, thank you, and thank you all for leading on this very important information sharing podcast. This is something y'all came up with, and I'm sort of falling in line with it because you've now made a believer out of me. People brag on you, and we thank you for helping us communicate about SGMC Health through it. So,
We love doing it.
Oh, yes, we
and
do.
it shows, and I appreciate it.
Thank you.
All right. Well, thank you to everyone who's tuned in today. And please be on the lookout for all of our future episodes. And you can go view those on any platform. And you can submit questions at sgmc.org/podcast.